Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne for Ask Dr. Payne. And Dr. Payne, we have a Facebook viewer with this question that was just sent in. She wants to know more about Brazilian butt lift procedures. She wants to know if they're permanent. She's been reading a lot, doing research online, and other people are posting on how they lost the fat in a matter of months. She was under the impression it was permanent, but has learned that implants may last longer or forever for that matter of fact. But Dr. Payne, maybe you can shed some light on the subject.
That's a very good question. And it's a common misconception about the Brazilian butt lift that the fat somehow gets lost or gets absorbed or disappears. First of all, let's just talk about the basics of what you can do to augment the buttocks. There's the implant-based procedures and there's the fat transfer-based procedures. Injection of other substances is really not a medical procedure. There are lay people that do it. It's a subject all in of itself. I don't recommend anybody do that because it can be very dangerous. When we talk about the fat transfer procedure, the reason why people think some of it absorbs, and again, a lot of these assumptions are made without any real scientific backup, is that there's early swelling after the operation. So the fat is put in, things swell up. Some doctors may not feel comfortable putting in more than 300, 400, 500 cc's. They may be afraid to put that much fat in there, and that's okay when they're starting off doing the procedure. For that reason, the combination of a small volume transfer and the surgical swelling that goes down in the first couple of weeks after the procedure can give the impression that somehow the fat has disappeared. It really hasn't disappeared. What I found, and colleagues of mine that do a lot of them and are comfortable placing larger volumes of fat, is that once you get past that initial swelling situation, what you have tends to stay with you and goes up and down with your body weight over time. So I would consider the results pretty close to permanent, as far as we can say that in the surgical field. So it is a good procedure, safe procedure, long lasting, and it's the early swelling that's probably going down. I'm not saying some of it may not, it's not going to be as big permanently as it is that first day or two after the surgery, but you don't lose that much of it, at least not in my hands. Regarding implants, implants are permanent in the fact that it's a piece of silicone that does not absorb, dissolve, or anything like that. What is not permanent is that implants have their own sets of characteristics that go with it. And implants are, because they're a foreign body, they can give you problems down the line. They don't always feel natural depending on how much tissue you have over the implant. They can turn, become displaced, and they can become infected even years after they have been placed. So it's not that implants have no role in this field. Probably something that should be kept in mind as a backup for people that do not have enough fat available and are willing to accept the trade-offs that come with an implant procedure. So hopefully that is a good coverage of the subject. There's more to talk about from there, but that gets the basics for you, and hope that helps answer the question.
Well, thank you, Dr. Payne. Appreciate your time. And if you have a question for Dr. Payne, please join us on our weekly Ask Dr. Payne segment. Dr. Payne, we'll see you next week on the next question.
Great, thanks.